in Durham, North Carolina. Introduction to food insecurities. The definition is food insecurity refers to the lack of consistent access to enough food for an active, healthy life. It is not just about hunger, but also involves nutrition, access to healthy foods, and affordability. In the national context, in 2020, 10.5% of the United States household experienced food insecurity. According to the Durham context, food insecurity in Durham disproportionately impacts Blacks and Latinx households with low-income neighborhoods, often referred to as food deserts, due to limited access to grocery stores offering fresh, healthy foods. Food insecurity in Durham. Poverty in Durham was about 22%. Black and Latinx residents are more likely to live in neighborhoods with limited access to fresh food. Many of Durham's low-income neighborhoods are far from grocery stores with fresh produce, creating significant barriers to food access. Food insecurity increases the health of obesity, diabetes, hypertension, and mental health challenges, as residents often rely on cheaper, less nutritious food options. The significance of this issue. Food insecurity is not just a matter of missing meals, but an issue that affects health outcomes, quality of life, and community well-being. The impact of food insecurity is particularly severe for communities already facing social inequalities, amplifying disparities in health and access to resources.
So, to combat the food insecurity, our proposed solution is the Durham Fresh Start program. So, the goal of the program is to improve access to fresh and affordable produce and health education in food insecure neighborhoods. The focus is community-led mobile food markets, nutrition education, and support for urban gardening. The Mobile Food Market Initiative partners with local farmers and Black-owned food co-ops, bringing affordable produce to undeserved neighborhoods weekly, which accepts SNAP and EBT sliding scale pricing model. It also creates job opportunities for local residents.
Nutrition education and community gardening. Host weekly cooking classes and workshops in community centers and churches, partner with Durham schools to implement youth gardening programs, and provide raised bed gardens to households through a lottery or application. The budget estimate. The mobile market setup will be around $150,000. Staffing is estimated to be $200,000 a year. Educational materials and garden supplies $50,000. Marketing and outreach $25,000. The total first year cost approximately $425,000. And the funding sources will be city grants, Duke Health Partnership, and private sponsors.
Evaluation approach. Here are the forms of evaluation. We will clearly define goals and objectives by having goals and objectives that are specific, measurable, achievable, relevant, and time-bound. We will also include stakeholder input as they're the ones helping fund the program. This will allow them to be involved in the process of setting goals for the ensurement of alignment. We will use the use of continuous monitoring and evaluation, which allows for the tracking of progress to check for any potential issues that may arise, adjust in accordance to any evaluation findings or feedback to better improve what might not be working, and use a dashboard or chart to display findings and potential recommendations from evaluation. Data and KPIs. For your evaluation, we will also implement the use of key performance indicators, referred to as KPIs. These are used as measurable values to demonstrate how effective our program is at achieving the goals we have set. Monitoring KPIs allows for goal tracking, performance assessment, and decision-based of performance. The collection and analyzation of data will be used as a form of evaluation. We'll have both quantitative and qualitative data, such as participant numbers or feedback and opinions from participants. We will analyze trends, comparisons like the program's benchmarks or similar programs.
Stakeholder engagement. Key engagement, Durham County Department of Public Health. They oversee community health initiatives and can provide data, guidance, and support for local implementations. Durham Public Schools. They have direct access to children affected by food insecurities and can help implement a school meal program, a weekend meal backpack, and nutrition education programs. City Council and the Mayor's Office. Essential for policy approval, funding, allocations, and can raise awareness. Grocery stores and farmers markets, key for solving food deserts, partnerships, and can help smaller markets in underserved areas. Securing support and funding. Support. Community engagement campaign. Use social media, town halls, school events to spread awareness and use community to generate pressure for support. Pilot programs. Host small-scale pilot programs in high-needs communities. Build a coalition. Host roundtable meetings with school officials, health departments, nonprofits, and community leaders about shared goals. Funding. City and county budget. Public health or community development funds. Corporate sponsors. Team up with local grocery stores and other healthy food vendors and host community gardening or produce giveaways. And grants. The USDA Community Food Project Grant.